aging? Hello glow ups! What is good, guys? It has been more than a hot minute, hasn't it? I hope you guys have been well. As for myself, life got in the way. I had to reprioritize, manage people around me and, somehow manage my stress levels. And yeah, with that comes the good old signs of aging. Yippee! Yeah. It kind of made me wonder, what is it about aging that sort of has us obsessed about it, especially for women, I think. And, it's probably, ironic because it is probably the most natural process of our own existence. And so, yeah, we just don't want to acknowledge it, I guess, and I mean, who wants to see, our skin sag and, have gravity just love us, the more and more we age. So I completely understand. And so while we're on the topic of this, I'm sure you can kind of guess what the topic of today will be. It is probably one of the most requested topic by you, the viewers. It is probably one of the most beloved topic of discussion, regardless of what age you are, whether it's about preventative or treating it or, fixing it. It is about aging. Yes. So let's get right into it. So you may recall a few months back now where I had posted a series of questions on my Instagram stories where one question was very specific on if you could ask one question to a skin doctor, what would it be? And the number of response I received from you guys was overwhelming, and thank you so much for your submissions. And so what I did is I took the time to sort of group them into the most common, themes and topics, and surprisingly, or not surprisingly, it had to do something along the lines of aging, like what is retinol? What is retinoid? What age do I start using it? Is it safe for pregnancy? You get the idea, right? And what I can say that I truly appreciate about social media is not just how I'm able to connect with you, the viewers, but it's also how I'm able to connect with other experts within the industry. So, not just with content creators like myself, but with cosmetic chemists and board-certified dermatologists and, licensed estheticians. And somehow we're all able to coexist and knowledge share, which is so amazing. And that's kind of what, truly makes this whole skincare community unique and wonderful. And so you guys are in for a special treat. I have a very special guest. Her name is Dr. Ranella Hirsch. She is a board-certified dermatologist based out of Cambridge, Massachusetts, and she is also the co-founder of Atola Skin Lab. Check it up here, link down here. Be sure to check it out. And so, long story short, I met Ranella through one of her Instagram posts because I happened to like it, because her post went something along the lines of fungal acne not being a thing. And if you know me and, how I'm trying to stop, the spread of misinformation, or trying to anyways, right? And so here is the actual term for, fungal acne. I'm not even going to attempt to pronounce this, but somewhere, somehow, someone decided, you know what, I'm not going to call it what it is. I'm going to call it fungal acne. And so, somehow, thanks to TikTok, it just went viral. And, anything that goes on TikTok, the virility amplifies by, the millions, billions, so, I was just ready to just wave the white flag and go you know what? I can't stop the spread of misinformation. And then I came, across Ranella's post and I'm like, wow, here is a, board-certified dermatologist. And she's also, trying to debunk some of those misinformation. And so I'm like, yes, go Dr. Hirsch, cheering her on the sidelines. And then, I got talking with Ranella and I had asked her how she would feel about coming onto my platform and talking to you guys about, something related to skincare, obviously. And so that's sort of how the questionnaire, transpired, because I wanted to know and just kind of gauge, and see pulse check on what would interest you guys, right? And so hottest topic, aging, and who better? A dermatologist. So, please welcome and thank you so much, for joining me today, Ranella, Dr. Hirsch. Please say hello to my audience. And I guess my first leading question will be, what is fungal acne? And I use this because, it's not really a thing. So yes, please help us clarify what fungal acne is.
Hello, Yo, and thank you so much for having me here on your platform. I'm really excited to join you and your followers. To answer the question about fungal acne, it's a good idea to understand what it isn't. So it's actually not acne. It got that name just circulating on social media where it became this go-to search item. But in fact, what it is an overgrowth of yeast that lives on the skin. And what happens when the skin reacts in some people to that yeast is that you get a production of bumps that are very similar looking. And they often appear in the forehead, right by the hairline. Sometimes we see them in the chest or the upper back, more typically in men. And it is, as I say, not acne. So what we often find is that people have been treating with treatments meant for breakouts and acne, and then just getting increasingly frustrated because it has not been successful. So yeah, that's how we kind of acknowledge what it is. And then it's actually treated with a number of different things, many of which are available over the counter. We use shampoos containing an ingredient called selenium. That is something you'll find in a shampoo you'll find right at drugstores called Selsun Blue. And for people who don't respond after about a month, and by respond I mean not just that you use it as a shampoo, you're actually using it a bit off-label as a body wash. So what I encourage people to do is allow it to really get onto the affected areas, have some time to sit, because it's important that it actually get into the skin. And then if after about a month of regular use you're not seeing improvement, probably want to come and see someone like myself, because at that point we might talk about treating you with some oral medications.
Thank you, Ranella. That was extremely helpful in clarifying what fungal acne really is. You know, it just makes me realize how important it is to use my platform, not just for the fun content, but also for, educating my audience, and also, hopefully help stop the spread of misinformation, because there's just so much out there. And as you know, my audience range from, young professionals to working moms, the age ranging from 25 to 45. So I guess the topic of aging was just most natural. So that is what, most of our topic of discussion will be today. And I guess my first question will be, what is retinol? Are there differences between retinol, retinoids, retinol and retinol esters?
What is retinol is one of the most common questions that I get. And how does it compare with kind of the other things that we hear of in this retinoid or vitamin A family? And the answer to that is, it's all about how our bodies convert those products. In other words, tretinoin, retin A as you might know it, is actually something called retinoic acid. And then everything else is really defined by how many steps it takes in the process of converting it from whatever it starts as to retinoic acid, which is the way that our body is able to take it up into our individual cells. So retinol, for example, requires 2 steps in order to be converted from retinol to tretinoin retinoic acid. Retinol, 1 step. And then everything else is basically a hybrid or relative from there. Why does this matter? Well, depending on how well something is taken up in the skin, it will give you a sense of how much you will have a reaction to it. So that's why you might often hear someone like me talk about with tretinoin having a significant skin reaction to it, where you might have some peeling and things like that. Whereas with retinol, things over the counter, usually not as pronounced. Certainly some people can have it, but just generally it's not quite as dramatic.
And so how do we determine when we need a prescription retinoid or even a visit to a dermatologist versus, buying one just from a cosmetic brand?
How to determine if you really need someone like me at all is, I often use the analogy of an athlete, of someone training. We could all go and buy a pair of running Snickers, start a routine, start really regimented running, and over time getting better, it's getting easier, our body's learning how to do it. What I find is if you hit a point where you're just not seeing continued improvement, so too with your skin. There are a lot of terrific ingredients over the counter you can try. Benzoyl peroxide, salicylic acid, among many others. Certainly the vitamin A we've been talking about. If you're using them properly, because many people do not use the products as long as they really should in order to get the effect, if you're using them properly and not seeing improvement after 6, 7, 8 weeks, probably not a bad idea to give someone like myself a call and see if we can't step in and help, maybe have you use them smarter or make some tweaks that might actually let the effect be a little bit better for you.
So this next one, I'm just going to read it quote unquote. They say, I'm in my early 20s and want to prevent wrinkles ASAP. Is there a certain suggested or recommended age that I start using retinoids or retinols? And is there such a thing as using it too soon?
So there is no official lower age limit on when you can start a retinol. I would be telling you an untruth if I told you every 22-year-old needed to start them. A much more important focus is because we know that the sun that you get in the first 18 years of life will determine so much of how you subsequently age. So for so many people, the right thing is just to really focus on sun protection. Generally, in my experience, we find that people hit late 20s, early 30s, and that's when they start to see kind of a little bit of crinkling around the eye, a little bit of a crow's feet in the middle, a little bit of an 11 line in the middle. And those are the people for whom we started to introduce a vitamin A, often in the form of an over-the-counter retinol that you can find at a drugstore near you. Again, there's no official right answer. That's just kind of the general that I see in practice.
What is the recommended percentage dosage for newbies that want to start incorporating retinols or retinoids into their skincare routine, and how often?
So I know you're asking about percentage, but I would sort of gently tweak the question. I think people often get confused by percentage of active ingredients in skincare, and it can be very confusing. I'd much rather have people think about it in terms of the whole formula that you're actually going to be working with. The actual percentages on what we call the INCI list or the ingredient list can be very deceptive, because something that might be listed there might work totally different because of the absence or presence of another co-ingredient with it. So what I strongly urge people to do is to really look for a product that's best suited for them. I have on my highlights on Instagram, I have a highlight called retinoids, and in there, among tips for getting started, I also include a few recommendations for products that are very good for people just getting started. They're in bases and formulas that are a little more gentle on the skin, kind of help you ease into the process of starting a retinoid product, and I would recommend people consider those among their options to begin with.
Is it true that your skin gets used to the percentage or dosage, and that's why, if you increase it, does your skin get dependent on the retinoid or retinol?
So I think the idea that people get used to something comes from this notion that we've done a pretty good job of explaining to people about, that there is this increase in cellular turnover, that there is going to be some level where you see maybe a little bit of flaking, maybe a little bit of peeling, maybe a little bit of dryness, even perhaps a little bit of breakout, because those aren't new breakouts that are being made. Those are the breakouts you would have seen anyway, but they're sort of accelerated in how quickly you see them on the skin. And I think because of that, there is this kind of bit of a skin myth that, in fact, when that settles and when you're just not seeing that anymore, that something bad has happened. And in fact, that can't be further from the truth. Skin doesn't just stop working with an effective ingredient like retinoids. It's just that your skin has gotten used to the ingredient in terms of not causing that level of irritation. It is still doing all the good things that you want it to do. So would very much want to get across the message that it's not a need to just shut it off and start something new. I realize that is a super common misconception, but in fact, it's one that just doesn't have the basis in the science.
I have another question that I'm going to read quote unquote. This person said, I am trying to conceive, and at what point do I stop using retinoids and retinols?
Right, trying to conceive, well, good luck, been there. We generally tell people we'd like to see it washed out of your system for a good 2 months or so, and that means complete cessation or stopping usage before you actually go off the pill. This is always a question in practice that I send you right to your OB to ask her, because every OB has a slightly different take on things, and every OB is really the person that, with you is the expert in your pregnancy. As I say a lot, I'm a dermatologist, I'm not your dermatologist, and the person that you really care about the most in that period of time is you and your OB, who know your individual pregnancy best. So that's who I generally suggest people ask.
My favorite question next up is eye creams. Is it absolutely necessary? Do they really work? What are your favorite brands if you use any?
Eye creams are a nice, not a must. Absolutely. Eye creams are something that for the right person who wants it are a great choice. I find that younger people who want to get started with something, because the wrinkling is so frequently here around the eye and in that area, often really want a target treat. And for those people, those are terrific choices. Lots of great ingredients, lots of great formulas that you can choose from at all sorts of price points. Then there are the sort of anti-eye cream people. I put a post on this on Instagram and got very strong responses in both arenas. The need for an eye cream does not exist. I, in fact, use my vitamin A, my retinoid, around my eyes, and very happy with what I have working there. But if it's something you want, it's terrific. It's not something that you need. You will do fine using good anti-aging ingredients from the face around the eye as well.
Next question, I'm also going to read quote unquote, adult acne, why does this happen? How can I prevent and treat it? I'm in my mid-30s, mother of 2. Please help.
Adult acne is one of the most frustrating things that I encounter, and I am with you. I certainly understand why it can be so vexing, especially if you thought you had dealt with it in the past and now all of a sudden what is happening? So the thing about adult acne is we have lots of different phases in life that involve lots of different things in terms of hormones. And that's really what is the thing that makes the most impact in terms of whether or not you might get those breakouts. So a lot of it has to do with where you are hormonally. Have you been pregnant? Have you been trying to conceive? Have you been on the birth control? Have you gone off the birth control? That's kind of traditional classic acne. There is also something just to throw out there, especially now in the time of quarantine and people experimenting with skincare. There's been a tremendous number of breakouts and people having reactive breakouts that really isn't necessarily pure acne. It's more just a reaction of the skin to something that people have done that the skin hasn't really liked. And it's important to differentiate those two things because one is being fixed by stopping what you're doing and one is often impacted by adding something to what you're doing. If you are finding, especially if there's a hormonal component, that you're noticing it relates to the timing of your periods, for example, great thing to bring to someone like myself. We can help you, whether it's just tweaking the birth control that you're on, using other medications, helping with some topical choices. There's actually a lot we can do that you really don't need to suffer if you don't wish to.
Last but not least, a favorite of our skincare community is on sunscreens. People have noticed that skincare influencers like myself, cosmetic chemists, dermatologists, estheticians alike have all been pushing sunscreens. So I guess the biggest question is, do sunscreens really help prevent with aging?
Well, I would hope the word wouldn't be pushing so much as encouraging. But yes, sunscreen is one of those products that does, when used correctly, exactly as advertised. There is really nothing more effective at making someone like me completely obsolete. If you use regular sun protection, and that's a part of your life from early on, and by early on, I mean childhood, you can avoid a tremendous amount of what people in their 30s and 40s bring to me as problems and points of skin concern. It is kind of something I say to patients a lot. You can spend $12 on a bottle of sunscreen or add a whole lot more zeros and come see someone like me to reverse the sun damage later.
Thank you again so much, Ranella, Dr. Hirsch, for your time and your valuable insights to this whole, topic around aging. I know that, skincare can be a very personal journey and that everyone's skin reacts differently. So, I certainly appreciate what you had to share, and I'm sure most of us will. Any final thoughts that you'd like to share as, a professional in this field?
Well, first of all, thank you so much for having me. It's just a delight to have this opportunity to talk to your followers and to get to know you a little bit better. I mean, I get asked a lot, all sorts of questions on social media, in person, in my practice. And one that kind of sticks out for me is people will ask me, well, Dr. Hirsch, what's the thing that you wish that someone, would do less of before they come and see you? And my answer is actually wait. What is so amazing is for so many people who wait and try to deal with things on their own, or who try to, power through, or I'll get through this. I won't let this bother me. I'm stronger than a few pimples or something like that. What I think often surprises them is just how much someone like myself is able to offer them, to really give them options so that the thing that was so bothersome to them needn't be anymore. So I think my best wish for your audience would be not to wait. If something's really bothering them, please try to get advice, because that really can be something very meaningful and save you a lot of hassle over the long haul.
Thank you again, Ranella.
Thank you again for having me.
Be sure to follow Dr. Hirsch at Ranella MD. And be sure to tune in next week for a deeper dive into vitamin A's, our favorite retinoids. Thanks so much for watching, guys. Peace out.